So now I am going to just introduce myself. That I am Dr. Hassan Sazu. I am the specialist and in charge in BRB Hospitals Limited in Dhaka. It is situated in the Bangladesh. So right now I will start about the new format actually, that is the PACES format. That is started from this Diet 3 2023. That's why it is known as PACES Carousel 23. But it will be continued from the next 24 also. So we should go for this carousel. Look at this, that PACES 23 carousel. All of us might get to know these things from our websites, that is MRCP UK websites. So this is one of the things. There are some changes in station 1, station 2, and station 5 also. So those who are new in the PACES, they will not face any problem because it is new to them. But those who have been given some exam previous attempt, like in 2022 or 2023 in June, July sessions, they might get some difficulties about these changes. But by practice, you can go for improvement and you can know these things are similar one. So let us start with the station 1. Let's see that station 1, there is one communication and one respiratory one. So what is communication? This is something that you need to go for. I will describe it in detail in further slides. But right now, I am just giving you some impressions about these scenarios. Like in the communication, you will face directly a patient with a scenario, or there will be a surrogate of the patient. It will be fully dependent on the situation of the scenarios. Okay, so that is communication. You will have 10 minutes only. In previous carousels, it was like 14 minutes, and there are some encounters over there, but there is no encounter through the examiners, no, right now. So I will make it you detailed so that it can be clear to you all. So right now it is in 10 minutes, the communication, but score is similar, like 16. The total, you need to pass this from above 11 or 11 you need to get. So we need to go through these stations by practicing, okay? So communication you will get in station 1, that is 10 minutes, and in respiratory, that is clinical stations, no? That is clinical stations. You will find a patient over there in the bed, and you will get some clues like examine this patient of shortness of breath, or examine this patient having cough, and anything else like can be written over the bedside. So you need to read that out, that what is written. Might be fever, a patient, elderly patient having fever, but the case is respiratory. So you need to just check in the side of the bed to see the questions. Then you will go for the patient. And this is the clinical stations, like respiratory. After that, these two encounter, you will get a interval, 5-minute interval. There you will just go for this sitting, and you will get some paper about this consultation. I will show this paper, how they will provide you a pen, a paper, and you will go for this. You need to be ready for the consultation. That is clinical consultation with a patient. So direct patient or direct patient surrogate could be there. And this consultation is 20 minutes. This is a long consultation, no? Previously, it was described as brief consultation, but right now it is changed to a long consultation actually. It will be encountered 20 minutes. I will make it further details so that you can understand this consultation, how they divide these minutes in like encountering, and sometimes you need physical examination. So all of these things will be discussed in my next slides, okay? After this consultation, you will get again 5-minute interval, and you will find station 3. It is 10 minutes clinical consultation like cardiovascular system. You might get any similar one like respiratory, that you will find a patient over the bed, and on the side of the bed there will be some written thing like a patient suffering from chest pain, please examine his cardiovascular system, okay? Sometimes it can be say patient having shortness of breath, please examine this patient. So you need to go for the cardiovascular system. So please read that note. Then we should examine the patient. So in the cardiovascular manner, you can get 10 minutes. Again, in the neurology, you will get 10 minutes. So there will be no gap in between these stations. The gap is here, 5-minute interval, and there would be no other gap. So then after station 3, you will go for the station 4 here, the 5-minute interval. You will get a note for the communication here. So the note is for this scenario. You need to be ready for this scenario, 5-minute interval. Then you will go for abdomen communication. Then again for the abdomen. Which one this will be? There will be some man who can guide you that whether you are in abdomen or whether you are in the station 4. If you got the paper, then you will go for the communication first. So again 10 minutes communication in station 4, and again there will be abdomen, that is clinical stations. No, after that 5-minute interval, you will get the consultation again, that is similar to this station 2. So you have long consultation station 2 and station 5. These are very, very important. Everything is important, but very, very important consultation. This should not be missed, because you can cover all the marks from station 2 and 5. Each of here, if you get any fault or any cut numbers, you can get passed through these clinical stations, like 20 minutes and 20 minutes. So we should be very aware about these stations. All right, let's go detail. We need to pass the examination, like PACES exam. We need to pass the skills actually. You have 7 skills you need to pass. That is physical examination. You can read it out through the website. So I will go the further slides. Then you can find that identify physical signs, identify the clinical communication case histories, like clinical history relevant to the patient complex and other systematic professional manner. You can get these things by practicing the stations. No, I think you all understand about these skills, like physical examination, identify physical signs. You can read it out. We will explain it further. Then let's go to the next slides. Again, duration of the encounter. You should know about this duration of encounter. That is communication 10 minutes, respiratory examination. These are the clinical stations. That respiratory, cardiovascular, neurological examinations, abdominal examinations, similar 10 minutes, 10 minutes. So these 10 minutes, you will have 6 minutes to examine the patient and 4 minutes for crossing. So by the practice, we will just being reflexed about these timings. So no need to memorize. You should practice in the bedside within 5 minutes. Okay. So within 5 minutes, it should be practiced. So these are the 10-minute clinical scenarios. I will make it in detail in later slides. Okay. Now communication skills. Let's see these things part by part. In the communication skills, they will judge us by 4 skills. One is clinical communication, another one is clinical judgment, another one managing patients' concerns, and patient welfare. You will get 4, 4, 4, and 4. So total 16 marks. You need to get 11 marks to pass the exam out of 16. So your target should be 16 out of 16. You need to get, because in clinical communication, you should get the full mark. In judgment, in patient concern, in welfare. These are the marks so much needed in this communication skill. So communication, we need to encounter about the clinical communication. We need to encounter about the clinical judgment, patient concern, and welfare. These all are the skills will be encountered for the communication. Let's go how it will be encountered. That organize the interview with the subject. Subject means the surrogate, who will, the patient or the relative. It is depend on the scenario. So you need to read that scenario very carefully, and you need to read it and note it also. And you will have a pen and paper with you. And with this pen and paper, you will write this, what will you just encounter and what will you say to the patient. So very much important to gather the clinical information from there. And the clinical knowledge you might apply. Sometimes knowledge of ethics will be judged. And then provide some emotional support, very, very important for the empathy and sympathy, by giving some breaking bad news, warning shots, giving some other aspects that he is in loss, or he is in demise. So you will give this emotional support. This should be learned. Then treat the patient with dignity and respect. So I think provide emotional support and treat the patient with dignity and respect. You can all provide with these things with your clinical practices. But what we need to go for that clinical information and clinical knowledge, you need to gather it from anywhere and you need to practice it. Okay. So these are the 5-minute interval. You will get a paper, 10 minutes are allowed for the interaction. So there will be no examiner to candidate. This is the changes. The examiners will not ask you, only observe you. Examiner will observe you only and give you the marks. There will be no vivas actually. There will be no question asked by the examiners. So only the observation. By just telling these things, you can get these marks. So how we usually get, let us see one scenarios. This is one of the scenario which came in this 2023 diet. Just I am giving this example so that we can understand. Like an elderly patient presented with hemoptysis, he was also in warfarin. Now it is stopped, but chest X-ray confirmed that is malignancy. Look, confirmed that is malignancy. So they told, explain the diagnosis and management plan. And this is the concerns asked by that surrogate and patient. Is it curable? I am feeling well. Why you want to treat? When will you start treatment? How you will treat? What about warfarin? These are the questions have been asked by the patient. So look at the scenario that is confirmed malignancy. So you have confirmed this malignancy. You should go for the breaking bad news here. And after breaking bad news, you should elaborate about these malignancies, how this happened, how it diagnosed, and how you'll manage. So part by part, you will know about these tricks and tips, how you can go for the communications. So this is one of those scenario. And I have just got some feedback about this scenario who has been encountered. Let's see with the feedback. Okay, is the network okay? Now I want to go with the slides. Look at this feedback. Here, look, by keeping the anonymous, one of the candidates. So look at this, that clinical communication is skill, clinical judgment is skill, managing patient concern, welfare. This is your judgment sheet now. So the examiners will write it here. That is satisfactory, borderline, or unsatisfactory. So we all need this satisfactory one. Okay. So here, look at this. If you got anything in borderline, you might get it in unsatisfactory if there is some problem in the judgment. So you need to go through these sheets also. You can go from these knowledges. These are written in the websites also. So look at this, the MDT plan, it was not planned for the discuss, and about no discussion about the further test. So the case is about malignancies, breaking bad news, you should go for, and you can get these marks like this way. So this is very much to know about the point. Satisfactory one is 2, borderline is 1, and unsatisfactory is 0. So we need to go for the satisfactory one, no? So I think it would be familiar to us if we go through these feedbacks. Now look, another scenario, I will go rapidly. Look at this, another scenario. It is also come in this 2023 carousel. Like a 45-year-old Mr. Smith was referred for urgent colonoscopy for suspected malignancy. Previous one was confirmed malignancy. It was suspected malignancy. Very, very important to get this information from the scenario. It cannot be done due to persistent loose motion. So the colonoscopy cannot be done. Now another alternative investigation like CT scan abdomen, discuss about it. So very short scenario, but you need to very cautious, because if you confirm malignancy here, you will fail. Because here written that is suspected malignancy. You should not write that it is confirmed malignancy, because one of our candidates that have been failed because just by means he just said this is confirmed malignancy and got bad report about their communication. So we need to be conscious about this scenario. One of this scenario very, very important. So you need to read it out and you need to point out what you need to tell to the patient, because right now you have no viva and no other encounter, just observation. So you need to be more cautious in communication. Okay, so one of the encounter here, we should go for this review. That is the case. The candidate here has lost a lot of marks. Look, that is unsatisfactory, unsatisfactory, unsatisfactory. The welfare is satisfactory, but because here some feedbacks over here we can see, that is convinced that this was a cancer. I want to show you these things so that you can understand that should not be, this was not be cancer, because it is a suspected cancer. But when he just encountered the patient, he told him that it is a confirmed cancer. That's the failing moment, you know. That's why that is put on, that is unsatisfactory, unsatisfactory. Whole image will be gone. You will get further wrong, you know, the observations after that. And I think it also missed the patient concerns also, because patient wants that when imaging will be done, and these are the things that might absent from the candidate. So we need to be cautious in the communication slides. So be prepared with the pen and paper with your scenarios, that what you might need to know. Let's go on further slide, that is clinical system examination. So right now, so far, we can see the communication skills, no, the 4 skills. Now clinical system examination, that is respiratory system in station 1, cardiovascular and neurological system examination, abdominal system examination. These are the similar things they will judge you by giving you some, you know, that patients. So the real patients will be encountered here. That is very, very much important. And we need to go for these further slides here. Look at the cardiology, neurology, respiratory, abdomen, 5 skills. Look, 5 skills. You need to go for physical examination technique by keep making it reflex. Physical examination technique. You need to able to detect the physical signs. You need to construct a differential diagnosis. You need for this, what is this? Ability to suggest sensible appropriate treatment and investigation plan. This is clinical judgment. This is clinical judgment. And ability to treat the patient dignity, respect means that is your welfare. So these 5 skills will be encountered here by the clinical stations, no? Cardio, neuro, respiratory, and abdomen. Let's see one station here. A 45-year, this is one case. You will go to the clinical station and you will see one note in the side of the bed, just 45-year-old woman with the shortness of breath on exercise. Examine the cardiovascular system. So you need to look for this, that is cardiovascular system, and you will go for that. You will have only 6 minutes allowed for the physical examination, followed by minimum 4 minutes of questioning the examiners. So there will be a viva about the cardiovascular system. Similar one, like this, similar one will be presented like respiratory, neurology, and other systems. No? So we need to be ready for the clinical stations as well. Okay, so now we can go for the next slides. Look at one of these slides. That is a case of cardiovascular system. Just I am showing it anonymously. Look at this, the diagnosis is mitral valve replacement, atrial fibrillation, CABG. So here what he missed, physical signs. Can you see this? Physical signs missed the atrial fibrillation. So you need to very much cautious during clinical examinations, whether you missed any physical sign that is present or not. So we should go for the pulse very much during cardiovascular examination, because it is very much important sign one. So you need to just practice it regularly and differential diagnosis construct it within your findings. Okay. So I am just going to further slides. Again, neurological slide, left hemiplegia. It was the good one, the most satisfactory one. All of the features are satisfactory. Now let's consult about the clinical consultation station 2 and 5, the long case. We told you about these things, that these are the new things, but in a new fashion actually. You need to be more vast. So these 2 stations, how they format it, Look at this. There would be 20 minutes. How the 20-minute actually breaks? Look at this, 15 minutes to take the history, examine the patient, and address the concerns. So concerns addressing, you will get 15 minutes, 5 minutes coursing with the examiner. They will give you warning shot 2 minutes, remaining at the end of 30 minutes, 13 minutes. So 13 minutes, you will get warning shot. In this warning shot, you will ask concern. What is your concern? What is your concern? What is your concern? So you should go for that concern description, whether you have differentials or you got the diagnosis. So you should go for the concerns because one of the pass mark here. And a paper will be given before the start of the session. You will get 5 minutes to gather your thoughts of this scenario. And this scenario get 28 into 2, 56 marks total. You need to get this 56 out of 56. I think it would be better to pass the examination. So next we will go, these are the slides of description. So these 7 skills, 1, 2, 3, 4, 5, 6, 7. Look the skills: clinical communication, physical examination, physical science, differential diagnosis, clinical judgment, patient welfare. All these you need to pass in each skill. So you can get the marks fully. You can cover up these marks by this station. So you need to know more about this station, these long cases. Let us just describe one of the cases you might get like this, that a written construction will be given, 5-minute interval. Like, look at this. Mr. Smith, 75 years old, assisted by son. There are a lot of talking here, but you need to know that 2-month history of tiredness and lethargy, history of loss of balance also reported. And you find here the sodium level is low, 120. So hyponatremia, this is a case of hyponatremia. You need to go for the cases, you need to approach for the hyponatremia of the patient, not for the tiredness and lethargy. You will ask for this tiredness and lethargy. This is for actually hyponatremia. So you need to read it out in the 5 minutes. And you need to also go for the vitals. Here the vitals all are given. So you need to go any abnormal sign over here, because here if the temperature elevated, it is one of the physical sign. You need to read it, write it out outside paper. So very, very much important scenario. So you need to got the clues and cues that what you will encounter and what will you examine. This will be prepared by our other mentors. They will teach you whether you can get in further information. So just this is one of the cases we can give, and how they can encounter you. Look at this. By these things they can encounter you. That clinical communication, you should ask about some causes of hyponatremia. These are the causes of hyponatremia actually. And then you will ask for the examination. Did you do the examination properly or not? Lymph nodes checked or not? Identify the physical signs. The patient is euvolemic. This is one of the findings. So patient is normal. That is one of the signs. You need to say that this patient is not hypervolemic or edematous. This is euvolemic patient. This is one of the physical finding. So I want to say one of the normal physical examination can be a physical finding. So you need to be cautious that you don't get any signs. Sometimes any candidate get panicked that I don't get any signs over there, but you can get the full marks of the signs. This is the tricks and tips. So very much important, that will be discussed later also. And also differential diagnosis you need to construct, that is the hyponatremia causes could be drugs, could be malignancy, could be any other things. So you need to categorize them: clinical judgment, patient concern, and welfare. So all these things will be discussed in further classes and further courses. So these things you might need to know and should be ready for these scenarios. One of the case came like in this diet 23, that is a patient having shortness of breath, and he has been suffering from systemic sclerosis, known systemic sclerosis with the shortness of breath. So you need to find out these systemic sclerosis complications mostly. So you need to go for thorough history, and also you need to go for further examination and management concerns. These are the scenarios could come. One of the feedback here you can see, so you can understand that how they can kill the marks. Look at this: satisfactory, borderline, and unsatisfactory. This is the systemic sclerosis case. And incorrect technique of respiratory examination. Look at this: incomplete respiratory examination. So you need to examine properly. You need to got the finding properly, respiratory findings incorrect, unpracticed. So you should be practiced. Management plan is not complete. So these are the things they might caught here in your skills. So you need to be so planned, then you can get all of these satisfactory marks with the exam. Very much because it is a long consultation, you need to get thorough discussion for this. These are the feedbacks. I think just you can see these things. Next, I just want to share the marking system you need to know to get through. Look at this communication one. This is anonymous one, not to be panicked or not to be seen that one of candidates, the unfortunate candidate got fail marks. But here, look at this, the communication one. What is the pass mark of communication? Look, that is 16. What is the pass mark in the respiratory? The physical science pass mark, that is 14. Clinical communication, you need 11. Differential diagnosis, you need 15. Clinical judgment, you need 20. Managed patient concerns, you need 10. Patient welfare, you should get this. So these are the features. You need these pass marks. Actually, I just showed you this for this thing. You need to know about these passing marks so that you can get your skills properly. Okay, so this is one of the mark sheet. So don't be panicked. Everyone will pass if they just go through their practice. And this one is for the passing one, that all pass marks are here, and we all here to pass. That's why you need to go through the proper, the guidelines and proper examination system and proper evaluation. So right now, I will just again go for this carousel. This is known as PACES 23 carousel that will be continued. Like station 1, there will be 2, station 2, station 3, station 4, and station 5. All of these are will going to be practiced and will going to be assessed by all of the examiners. So these are very important carousel, and I hope for this one of our courses, MRCP PACES course in hybrid mode. It will be held in Kolkata at KPC Medical College from 9th February till the 11th February, Friday to Sunday, and online session will be there. So I will conclude my session, though I take some more time. Thank you very much. So if you have any questions or anything to know.